Okay, I'm just going to ask you to walk towards me back and forth, please. Okay, I see the left shoulder is higher than the right. If you want to please move forward a little bit. Now I'm just going to assess your posture. Good. I see the left shoulder is higher than the right. The left ear is higher than the right. If you want to turn and face this way, please. I see forward neck posture on the right side. Turn to the back, please. Yeah, turn. Yeah. Good. Shoulder is the same. In the other way. And if you want to turn face up. Turn face me, please. Yes. And now I'm just going to ask you to bounce on your heels. We're just looking if you have any pain going up to your spine. Okay, just bounce. Good. Do you feel any pain?
No.
Okay. And now we're just going to go into global flexion. If you want to just core into a ball. Please. Okay. Back up.
So I'm just feeling a little tightness in my waist here.
Your waist?
Yeah.
Your lower waist, right?
Yeah.
The lower back, okay. And now we're just going to go into global extension. So do as if you're hugging the world. Okay, do you feel any pain when you do that?
No.
I only see that you're leaning towards your right side. And now we're just going to do the hip circumvention. So you're going to do this twice and then the other side twice. I see you have pretty even movement. And now we're just going to do the shoulder circumvention. And then the other way. And pull forward a little bit. Come forward and do the other one. Okay, I see your left is a little bit restricted. And now we're just going to do the cervical rotation before we do the trunk. So if you want to rotate your neck side to side, that's pretty even. Do you have any pain when you do that? Okay. Movement is same. Okay, good. Now I'm just going to come and then put my hands on your hips to stabilize your trunk, and then you do the trunk rotation, okay? So if you want to please just onto your back and then put your hands on across your shoulder. Good. And now I'm just going to ask you to turn side to side. Okay, there is no pain. Do you have any pain? The movement is stable. Stable movement. I'm going to ask you to put your hands across your shoulder. Right, left. And then in the ankle, up the ankle. Dip circles on the left side. And then I'm going to ask you to lean forward a little bit. Up sleep on the left. Okay, come back up. Okay, now I'm going to ask you to put your hand on my shoulder, please. And then I'm going to ask you to lift this leg up. Like that, you can put it back down. And then I'm going to ask you to lean forward. Okay, that's good. We have a clear side. You can put your hand back. Thank you. So this is pretty even. And now I'm going to ask you to turn. Okay, turn the other way. And if you want to please put your hand on my shoulder. This hand on my shoulder. Yeah, and then please lift up this leg. Good. That's your yes and yes. And now lean forward. Lean forward a little bit. Okay, that's good. We have your PSH ready. If you want to put your hand back on your chest. There is no, that's also even. Michelle testing right standing. Okay, I'm just going to ask you to lean forward a little bit and then curl your shoulders in a little bit. Good, thank you. Okay, now I'm going to ask you to extend towards me. No, to just extend backward towards me. Okay, good. Now I'm going to ask you to go back in neutral position. Just neutral. Your head in a neutral position. So we have the client seated on the table. His feet are supported on the ground and his knee is rest towards the edge of the table. And I'm just going to start with a seated assessment on him. Okay, so we're just going to compare between both sides on the reflex assessment. Let me know if the feeling is different from one side. Starting from your A side. The same feeling?
Yeah.
Feet like it. Go. Feelings are all the same.
Like I felt a tingling sensation here.
You felt a tingling sensation on your right.
Yeah.
Your right kneecap. Okay. Thank you. Okay, so now I'm just going to take your blood pressure. We're going to do 2 on the left and 1 on the right, okay? If you can just fix your ribs. Let me look for your brachial arteries. Okay, that's good. Thank you. 126 over 80. $126 over 80. It's the problem. Yeah. $128 over 80. Are you sitting okay?
Yes.
Did you write down? I'm going to ask you to put your hands across your shoulder. Good. And now I'm just going to rotate, stabilize your trunk and ask you to rotate right and left. So rotate. So there is less movement going to the right, so right is restricted. Okay? You can put your hands back down. Yeah. And then now we're looking for high helium. High helium is even when the client is seated. High helium even. Deep sulcus is still on the left when the client is seated. Left. And then I'm just going to ask you to lean forward. Up sleep is on the left. Come back up. We have up sleep on the left when the client is seated. Okay. Good. And while the client is still in this position, we're just going to do the spinal assessment in neutral flexion and extension. Okay, first we're gonna do it in neutral. And I'm going to ask you to go into flexion a little bit, so just lean forward a little bit and then up your shoulder. You can come back up and then come back out a bit. Thank you. So you can go back out. So that is neutral. We're just going to be starting with the lymph node assessment. First, we're going to be starting with the pre-auricular lymph node, which is just anterior to the ear. We're doing it unilaterally, so one side and then the other. And then we'll move to retroauricular lymph node, which is proximal to the masted process and also posterior to the ear. Next, we'll do the submandibular lymph node. We have more movement on the left side. And moving into the submental. And then we'll move to the clavicular lymph node. So for this one, we have to be careful of the coracoid artery. So we only have to do it unilateral. I'm just placing my hands on the SCM here. So for this, I see there is more movement on the right side. And now moving into supraclavicular. And then peristanium. I'm just going to ask you to open your hand a little bit. And then we'll do the auxiliary lymph node. Again, we're doing it unilaterally. And now we're gonna do the iliacus. Just gonna keep it flexible. And then we'll do the inguinal lymph node. Okay, you can also leave the other one too. Perfect, thank you. I'm just going to ask you to extend one. And now we're just doing the popliteal lymph node. I'm just placing my hands on the popliteal fossa. However, I'm looking to see if there is any Baker cyst. Now we're just going to move into supine assessment. We have the client's leg off the table a little bit. Left is restricted on adduction. Left is restricted for, no, right is restricted for both legs. Adduction, no, abduction, abduction, okay? Wait. For the lower limb, supine. Right leg has more weight. Left is restricted on the compression. They move evenly on compression, and they also move evenly on decompression. So unilaterally, adduction. even. Unilateral abduction. So right is restricted, unilaterally abduction. Okay, stop. Because you can, moving on to the upper limb of the client, he doesn't have any history with his shoulder, so he's able to extend. You see there's a restriction on the lower abdomen. The movement doesn't go past his lower abdomen. Both sides is the same, unilaterally and then bilaterally. The movement doesn't go past his abdomen. And now I'm just going to move into cervical traction. And then cervical restriction. Rotation is even, but when I did the traction, I felt like there was a restriction on the dura tube. Okay, can you please show me the tip of your pubic symphysis, your pubic bone, please? Thank you. Okay, I'm just going to place my hands in there. Thank you. So we see that the left is higher. And then I'm just going to check for the length of your ASIS to your umbilicus. So the right is longer. Good. And now we're still looking for inflate and outflare. So that is even. Good. Now I'm just gonna do functional assessment. So abduction is restricted on the left. That's within normal range from the table. And this is around 10 centimeters from the table. Okay, I'm just going to ask you to lift your toes to push your toes towards your head. Does it flex? Good. And now I'm just going to ask you to push towards my hands, plantar flex. Okay, they both have the same grip, the same force. That's it. Thank you, thank you. First closure assessment. So what I'm gonna do, I'm gonna place my hands on your ASIS and you're gonna lift your leg. Now we're looking for ligament laxity if the movement is easier. Okay, so I'm gonna place my hands on your ASIS and I'm gonna ask you to lift your right leg. Okay, back down. And now your left. Good, back down. Is that an easier movement?
Yes.
Okay, since the movement is easier, that means there is a ligament laxity. However, we still have to do the contralateral resistance technique to rule out muscle imbalance. So for that, what I'm going to be doing, I'm going to place my one hand on your shoulder and you're going to lift up the opposite leg and roll your shoulder towards the leg. Okay? So I'll place my hands on your shoulder and I'm going to ask you to lift up your leg and then roll your shoulder up. Good, relax. I'm just going to come in between your legs. Is that okay?
Yep.
Good, thank you. And then I'll just open the PSISs. Good. Thank you. Now we're just going to start with the Michelle testing. We'll do the Michelle testing in neutral position. Okay, now I'm going to ask you to please come up on your elbow and then we'll do it in extension. Good. So that is even both in neutral and in extension in the prone position. You can go back down on your hands. Good. And now I'm just going to be starting with deep circles. Now first I'll look for high ilium. Just going to move your palm down a little bit. So we have the high ilium on the left when the client is in prone position. Now I'm just going to ask you to please come up on your elbow one more time. And when the client comes up to his elbow, the high ilium disappears. Go back down, thank you. And now we'll look for deep circles. PSIS in the NICU, up the NICU. So deep circles we have on the left. I'm just going to ask you to come up on your elbow. We have the deep circles on the left in neutral position and it disappears when the client comes up into extension. Okay, you can go back on your elbow. So we have the coccyx is higher on the right side. Can you please come up on your elbow? And when the client comes into extension, it remains, it doesn't go away. Okay, go back down. Thank you. Nutation and counter nutation are both even. We're just moving into the functional assessment in the prone position. For the bending knee test, to assess the weight bearing and load symmetry through the lower limb that is caused by the twisted pelvic. We have a right outflare and high left pubic, which will alter how the body weight is distributed down to the knee. Okay. And to assess him, I have him standing in 20 centimeter feet apart, and I'm just gonna check to see where he has, as you can see, the right is kind of stiff and the left moves a little bit more. The same amount of pressure is what I applied to both knees, behind the knees. Okay, so we have our answer there. The right is bearing more load and the left is more free. Okay. Now we're moving into the straight leg raise test on the client, to see what the issue or why the dysfunction on his pelvic region and the ad flare that we saw in the previous assessment. First, I'm going to ask you to lift up your right leg and let me know if you feel any local pain surrounding your pelvic region. So if you want to lift up your right leg, okay, you can put it back down. And then your left leg, please. Back down. So I noticed there was a bit restriction when you were lifting up your left leg. Was there any local pain on your pelvic region?
Yeah.
So you felt pain on the left side of your lumbar spine?
Yes.
Okay, good. Your shoulder, to resist your shoulder, and then I'll ask you to lift and roll at the same time. Lift and roll. Okay, relax. Is that easier?
Yes.
Okay, since that is easier, that means we have ligament laxity on the pelvic region, so we're going to be doing the treatment to help improve the dysfunction. We're moving into treatment. We're going to be starting with the general osteopathic treatment for the lower limb to warm up the muscles. the short gun technique to realign the pubic tubercle. First, I'm going to ask my client to flex his knees and then bring in his medial malleolus together. And I'm just going to place my hands in between his knees, and I'm going to ask him to practice, like we're just going to rehearse. So you're going to be bringing your both knees together. Let's do it 3 times. Okay, relax. And now we're going to do it once. And originally you're supposed to go 100% effort, but now we're just doing 80% effort because we're trying to modify the technique to, you know, to suit your specific need. Okay. Okay, so now I'm just going to ask you to bring your knees together. 80% effort. 1 to go. Good, and relax. And I'm just going to ask you to stay in that position for another 20 to 30 seconds just to help the contracted muscles to adapt to the new position. So this is the modification of our technique that we did today. Now I'm just going to ask you to put your legs down. So don't forget, this was a focal treatment that we did, the shotgun technique for realignment of the pubic tubercles. Thank you. Now we're moving into the half leg correction, which is a focal technique for the right ilium. I'm just going to ask my client to flex his knees. And then I'm going to ask him to, place my hands on the ilium, and I'm going to ask him to resist my pressure, 10% effort for 10 seconds. Okay, so if you want to push out towards my hands. Okay, relax. We'll do that one more time. Relax. One more time. Relax. Thank you. So that is the treatment to correct the arch flare, a focal technique. Thank you. Now we're just moving into the long and short adductors technique. It's an MET technique, but we'll be using it as treatment to help realign the pubic symphysis, and it is a local technique. Okay, I'm just going to ask my client to, and I'm just going to come in between his legs. So we're going to be doing, okay, if you want to push your knees towards me, and now we're doing 10% effort for 10 seconds. Okay, relax. This is the short lever, and we'll do that one more time. Relax. And we'll do that the last time. 10% effort for 10 seconds. Relax. And now moving to the long lever. I'm just going to place my hands on the medial malleolus, and I'm going to ask you to resist my hands. 10% effort for 10 seconds. Let's go. Relax. We'll do that one more time. Relax. We'll do that one more time. Relax. Good. And that is the treatment for the long and short lever to help realign the pubic symphysis.